All right, good afternoon, everybody, and welcome to Centering Doulas, Justice and Policy Maternal Health. My name is Iman Ali. I am a junior at Tufts, and for the conference, I've been working on the Tech and Logistics Committee. So now I'm gonna introduce our lovely speaker. Chanel L. Porchia-Albert is the founder and chief operating officer of Ancient Song Doula Services, a reproductive health organization focused on providing resources and full spectrum doula services to women of color and marginalized communities. Her work within infant and maternal health has led her across the globe to Uganda, where she has served as a maternal health strategist in rural war-torn areas to address the lack of resources to birthing mothers. She is a certified lactation counselor, midwifery assistant, and vegan chef, and has served on various advisory boards throughout the country. She has served as a consultant for the New York City Department of Health and Mental Health Hygiene and assisted in the creation of the Respectful Care and Birth Document and other healthcare institutions engaging providers in birth justice. And she also serves on the advisory board at Iridian Labs at Harvard Medical School, is on the board of directors for March for Moms, and a board member of the Foundation for the Advancement of Midwifery and Village Birth International. So she's very accomplished, and we have the pleasure of having her as a speaker today. So with that, I will pass it on to you, Chanel.
Greetings, peace, everyone. What's the vibes? What's really good? I hope that you are enjoying your day. I'm hoping that you are enjoying this conference. I want to thank the folks who organized the conference for this opportunity to be able to share space with you all. You may have hear some background noise. I do have 6 children, so that's just the realities of life, especially in this Zoom world. But I'm really super excited to be here. And I just wanted to make a correction to my bio. I'm actually on the advisory board of Birth Future Foundation. And so if you don't know about them, please go and check them out. But they're doing great work to center equitable funding for maternal health, as censoring midwifery models of care. Okay. So let's get this popping. So centering doulas, justice, and policy in maternal health. What does it all mean, right? We know the issue. The issue is that African American pregnant people are 3 to 4 times more likely to die of childbirth-related complications, and our medical system is ill-equipped to center the lives of BIPOC pregnant people and our families, right? So what does it mean for us then within this healthcare system? Prior to the pandemic, we were already going through a pandemic of sorts. We already had activists who, advocates, families, community members, individuals within the sectors of public health who were having conversations around racism and bias within maternal health, right? Understanding the foundation of our reproductive health access in the United States was not created from an equitable standpoint as it pertains to Black, Brown, and Indigenous people, right? And so African American and Indigenous women and pregnant people at an alarming rates are at the intersections of inadequate housing, environmental injustice, food insecurity, violence, trauma, mental health, and the lived experiences of being Black in America. And now we couple on top of that a pandemic. So we have a pandemic in top of a pandemic, right? Because what happens when we already have a system that is strained, that is at its a tipping point, right? And I think we're a little bit beyond the tipping point when it comes to censoring Black and brown bodies within the US healthcare system, especially as it pertains to reproductive health. As we look at the evolution of, again, healthcare, starting from the enslavement of African women, going into the Reconstruction era, we go into Jim Crow era, and lack of access, and the ways in which our bodies have been used in the advancement of science. So one breath you're usable, the next breath, and you're seen as something that's a necessity, but in the other breath can be seen as inhumane, and not fit for the same equal rights and justice as everyone else. So what does it mean then to try to address those frameworks? And there's many different ways to be able to do this. There's no one singular avenue for addressing maternal mortality and morbidity. There's no singular way for addressing racism and bias within care. But what we do know is that doulas are part of that component. And so what does it mean to center the doula? And I see the doula as an intervention is a key component to centering the human rights and bodily autonomy of the patient when incorporated within an equitable collaborative care framework. We like to talk and we like to uplift collaborative care frameworks, but what does it really mean to have an equitable collaborative care framework? Where we have individuals who are working together from the time someone comes to the institution, because we like to blame the institution for the outcomes, but it's not the institution. The institution is just a building. It's the people who are filling the buildings who are the problem when it comes to inequitable healthcare, right? It's the socialization of white supremacy, right, and the colonization of peoples that has led us to the place of where we are right now. And so, yes, the doula is part of that. That means that we have the doula, we have the nurse, we have the midwife, we have the OB, but we also have the community, right? And we understand that the doula should not be the focal point in reducing the maternal mortality rate. We should not be. We can't put all of that burden on a one particular individual or individuals, or organizations to solve a problem that is systemic, right? And so it's not just about the interpersonal relations that are happening, because yes, that's a key component, but it's also about the frameworks in which we choose to learn from and how we choose to center other people and the humanity of in other people. We also understand, we need to understand that if you're going to ask a doula to do this work, and especially doulas of color who are centering equitable frameworks, that you need to pay them equitably for the work that they are also distributing within their communities. That means that we need to understand the principles of a community-based doula, right? Where that doula is incorporating a human rights framework, is centering birth justice and the reproductive justice framework. They're rooted in an understanding of racism and discrimination, and how it's not just that reproductive experience that they're having at that very moment that is a catalyst for how they will be cared for, but it's their life experiences, right? It's their lived experiences since they have physically come out of someone. We need to center a culture of care, recognizing the intersections of health and racial equity, centered in harm reduction methods to address intergenerational trauma, right? And so it's not that our bodies are not equipped to be able to meet the needs of life, right? And to live, right? But what happens when you've been in survival mode for so long? What happens when survival methods have now become adaptive behaviors that become normalized, and not from the point of the patient, right? Because we like to put a lot of the burden on the patient, but not and not necessarily understanding the provider too has that internalized trauma, right? The ones who have Black and brown providers too, who have come into this work, who said, I've come into this work, I've taken an oath to do no harm, but now I have been indoctrinated in a system that doesn't even see me as equal to be able to serve my own people in a way that uplifts them and can center them, right? We need to take intersectional approaches. We need to have patient-led advocacy incorporated into care. And that's where we're really centering the bodily autonomy of the individual in the cultural humility framework. What does it mean for us to learn from the patient, right? And to understand that it's not for a goal of trying to like come to an endpoint, right? It's not a check off box. It's having a sheer appreciation of the individual that's in front of you, and understanding that when I'm working with someone, I'm not working with just them. I'm working with a community. I'm working with their ancestors. I'm working with the future generations that are to come, right? And you're centering the humanity of not just that individual, but of a lineage and a line, right? And understanding that the work that we do is generational, it's continual, it doesn't stop. And so birth justice becomes key in that, right? Because when individuals, regardless of their race or gender identity, are able to make informed decisions during their pregnancy, their childbirth, and their postpartum for themselves and their babies, that is free from racism and implicit bias, without fear of coercion into unnecessary medical interventions, reprisal for the refusal of care, and or face inadequate medical care, and are able to express their full human rights around the reproductive health choices for themselves and their families, that incorporates that intersectional and structural needs of the individual and communities, guess what? Then we'll start to see those iniquities that we continuously hear about diminish, right? We can't, we'll stop having the conversation about maternal mortality because maternal mortality won't be a thing, right? Because we'll be working in conjunction, not just with the individual, but with the communities that they serve, right? It will no longer just be an institution in the place, but it'll be an extension of those communities that is working towards the equity, understanding that that approach has to be fluid. It's understanding that reproductive justice is not is a movement and not just a moment. I hear a lot of talk now in public health and incorporating, I'm coming from a reproductive justice framework, and it's a beautiful thing, right? But we have to make sure that we're doing it from a perspective where we're really centering the right to have children and people to parent those children in safe environments that are free from unprovoked violence, the right to not have children and to have the necessary supports in place in order to support those decisions, right? And so what does it mean for us then to, and that unprovoked violence is not just what happens in the streets, right? It's not just what happens in the home. It's also what happens in the institutions that they face. It's the constant reminders, or the conversations around sterilization. It's the not believing someone when they feel pain. It's the dismissing them. It's the internalized condescending tones. It's the using systems such as child protective services as, for towards fear-based coercion to get someone to comply with a medical intervention, right? It's the individual interpersonal bias that someone may have, right? So the reproductive justice framework is something that is continual. When we talk about mindfulness, what are we really meaning? We're meaning that we're being mindful of how we are in this present situation, but understanding that it's not about just having a healthy parent and a healthy child. It's about the experience as a whole that affects the individual and their the way in which they're able to parent their child in a loving and affirming way. And so that means that we need to have policy for the people by the people, right? When we're looking at policy, and Ancient Song and myself, I've done policy on city, state, and federal level. We're looking at policy from a community-centered approach, which means that community is active stakeholders in the development of that policy, right? We're fluid in the approach. I know we like to have these standardized things in the ways in which we do things, but understanding that community is ever evolving and ever changing. So what someone may need, or a community may need at one particular moment, based on the times and the situation, much like we experienced during a pandemic, where you had not only a healthcare crisis that was going on, but you also had social unrest. And the social unrest was just an overflow of the years in which things start to boil over, where people are just not listening, or they choose not to hear, right? We need to be intersectional. We need to understand that we're looking from this policy from a birth and reproductive justice lens that seeks to understand and mitigate unintended consequences, right? So we're looking towards the future too. What effect is this going to have on future generations, right? And it realizes that it must center the reality that racism has put on our healthcare system in a long-standing pandemic that will take time to address, but can be done with the willingness to push the norm. We have to push the norm. And what I mean by the norm, I'm not talking about our new normal. I'm speaking of the norm that we had before, right? Which was already a pandemic. We were already in crisis mode, right? Because BIPOC people have been outside the norm for generations. We've been going through this for years. We've always had to find ways to center ourselves with mutual aid, with equitable healthcare, right? With the resources that are necessary to sustain ourselves, with like, what does it mean to be in a safe space? What does it mean to find love? What does it mean to find peace? What does it mean for us to find joy? What does it mean for us to have hope? Right. And so, within the narrative and the conversation of speaking about what is happening, we also need to uplift the things that bring us joy, right? That bring us hope, because we don't want someone going into a system and feeling disillusioned by the realities of, as a parent who's coming in, because I feel like the minute you become pregnant, you're a parent, right? Because of the choices that we're making, you know what I mean? They're coming from a perspective of really wanting to center the child that's going to be there in the future, right? And so, and if we're looking at it from the approach of that, then we understand that it's our job, right? It's our duty to center that person in a way where they feel affirmed, where they feel the love, and they feel like, okay, someone is listening to me, someone genuinely cares about me, someone sees the humanity in me because they see it in themselves. And I leave off with this. To build community requires vigilant awareness of the work we must continually do to undermine all the socialization that leads us to behave in ways that perpetuate domination, right? We have to move away from things that just don't work. We need to move away from, institutions that funding institutions that continue to perpetuate harm. We need to move away from funding institutions that continue to perpetuate the same outcomes. We need to move and center the communities that need the support. We need to move towards what does it mean for someone to get their prenatal visit, but and then be able to be connected to like a CSA, right, and get groceries at the same time, or get diapers and essentials that they need, so that again we're no longer living in survival mode, but we're thriving as a community, because it takes a community to raise a family, right? It's not the individual frameworks, it's us all working together collectively to center a pedagogy of hope within our communities. Thank you. I'm gonna stop sharing and y'all can ask questions. Ooh.
Thank you, Chanel. That was really beautiful. So we do have a couple questions. The first question is, how do you see doula care being integrated within a new emerging field of telemedicine and telehealth?
Okay, give it to me one more time. How do I see doula care
Being integrated within a new emerging field of telemedicine and telehealth.
Okay. So at the inception of the pandemic, I came up with a virtual model to be able to support doulas in providing care, right? And our job is always centered on human connection. What does it mean to center people? But what does it mean when we, don't know necessarily or can't do that? It means that we find other ways to be able to. And so, I was able to train 350 doulas nationwide to be able to offer virtual doula services last year in 2020, which is a blessing. But what it also means is that we have to understand that as doulas, tech is a reality, right? Tech is a movement that is not going to go anywhere, right? So we really have to be adaptive to that, but we also have to understand access and accessibility to tech is something that becomes a constraint for some of the communities that we really want to serve. So looking for equitable ways to be able to do that, using platforms like Zoom, WhatsApp, text messaging, being able to create a feeling, right? Using music, using the vibes, like using the energy that's necessary to center. Sorry, y'all, my computer's gonna die now. Like 2 seconds. Give it to me. To provide care models that. I'm sorry, y'all. I don't want to get disconnected. Apologies. We just need to center care models that are affirming and know that they're continuously fluid. So I hope that answered your question. And tech is not going anywhere. So like being able to move to apps, being able to move towards tech safety, understanding that some people don't necessarily, want to be in those platforms, you know what I mean? So it's not going to go away. So the incorporation of it means that we're now looking at what does it mean to have integrative models that supports, that is integrated within midwifery care and a doula, and OB care and a doula. So where folks can be completely centered in their care.
Wonderful. So we also have another question that's asking that they would love to hear your thoughts on proposed legislation to cover doulas through the state Medicaid programs.
Okay. So my thoughts on that is this. I think that in order for doulas to be able to, I think Medicaid is an essential, especially if you're working from a community-based model. But I think it also needs to be done from a perspective where community is centered and we're looking at the unintentional consequences of not putting a burden on the doula who is providing said services. And the reality is that individual payer models for doulas are not necessarily ideal, and I'll tell you why. Because the actual the doula themselves can't necessarily take on the task of being able to do all of that by themselves, right? The billing, understanding that you may not necessarily get reimbursed right away through Medicaid because it is a federally funded program, state and federal funded program. So it could take 6 months for reimbursement or more, or the claim may not even go through, right? We also need to understand that um, uh, doulas can't take on that many clients in terms of birth clients, right? So, they may have maybe one or two a month. And, that doesn't necessarily offer sustainability for the doula who maybe is trying to do this full time. And so any model that is proposed, I think they need to make sure that they incorporate organizational funding, and so administrative funding for the organization, the community-based doula organization that's providing that care, so that that doesn't become a further burden on the organization to be able to bill for the doulas. They could do it at a higher volume and be able to reimburse the doulas, or even put doulas on salary so that the doula can be paid. But if they are going to do single payer models, then they need to have the necessary social supports to be able to do it, right? So what does it mean for doulas to accept claims and process them on their own? What does it mean to, if you're going to have doulas should go through a program that is centered in, cultural humility, that's centered in reproductive justice, birth justice frameworks, because, right, we're working with, I call them, I don't like to say marginalized communities, I call it centered communities. You're working with centered communities, right? You're working at the intersections of various different things. So what does it mean to really support that in an equitable way? Well, that means that you need equitable training, right? So like Mama Shafia, Ancient Song, Mama Toto Village, Uzazi Village, like lifting up these, Black organizations, Black women-led organizations that are doing this work, right? Who are providing this education, and there's many more that are providing this education in an equitable way, right? We also needs to be at a reimbursement rate that is equitable, right? And oftentimes the model is in comparison to what midwives and OBs are reimbursed, and that reimbursement rate is very low, right? And so understanding that, the reimbursement rate should be something that is, at least 8 and above. And I'm just, giving a figure off the top of my head. One of the reports that I would say folks should check out is something that I co-author with Village Birth International and Every Mother Counts, which is Advancing Birth Justice report that really talks about Medicaid reimbursement. It has been used to guide folks through their various different pathways to them to be able to do the work in an equitable way. And we do give payer models, to be able to censor it. It's a really comprehensive report. We really, yes, 800 and above, but it's a really comprehensive report that's there that really talks about the unintended consequences, talks about, having a doula registry, not making it mandated that doulas be licensed, because that's a problem that we see popping up, is that now states want to say, oh, doulas need to be licensed. And I don't believe that doulas need to be licensed, you know what I mean, to be able to do this work. If you're a doula and you want to be able to accept Medicaid, there's nothing wrong with there being a registry for doulas who accept Medicaid, right? But if you are not doing that, then I mean, there's no need, you don't need to be registered with the state. Doula, is something that is an ancestral practice that has been around for years. Prior to the name coming into fruition, we have always had ways in which in our communities to be able to support one another. So we really have to look at when folks are writing these bills, what are the unintended consequences that are coming up? Most recently, there was a bill that was presented here in New Jersey that said that if you didn't register with the state and this was all doulas, regardless of whether you accepted Medicaid or not, then you had to, you were prohibited from working in the state. And we were like, no, 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 like that's not gonna work. You know what I mean? And so, doulas galvanized within the state, and we were able to get the bill taken off of to moved out of it. But these are some of the things that are coming up. And if you are not watching this and you're not being very mindful, then it could creep in without you knowing. So it's really important for doulas and advocates, those who are like really looking at policy, to continue to be on it, talk to policymakers about, what does it really mean to center equitable models? What does it really mean to have doula Medicaid reimbursement? Why it's necessary? Why organizations of color shouldn't have to prove that they are equitable models for this? Because again, these are the models and the things that they require are based off the models that we teach every day. Right. This is based off of the work that we do every single day within community. And so, yeah, like, we need to uplift those organizations outside of the organizations that, are considered to be well known. Go ahead.
So we have a couple other questions. One being, how can Black and Brown individuals navigate contraceptives like IUDs and other forms of birth controls in an RJ framework?
Oh, from an RJ framework, I would say one, we often forget, but midwives can do that same type of care. And so I would seek out, midwives who offer, sometimes some of them will do in-home care and provide, IUDs where they'll come to your home and they'll, do an IUD right there. Or in their office. It's done from a totally different framework that is less intrusive, that is really patient-centered, that is, equitable. So look to midwives for that, because, we don't do that. But also, like I tell folks too, when you're deciding to pick an OB, it's usually based on someone's insurance, right? Okay, understandable. But when you go there, like, it's really important for us to also, you have the right to interview someone. You have the right to ask some questions. We'll make an appointment, we'll go inside, the nurse is there, they'll do a whole workup. They're like, okay, take off your clothes, the doctor will be in a second. And what do? We take off our clothes, right? And then you don't even know if you like this person's energy, right? But yet, we're doing this. And so it's really important for us to, like, don't take off your clothes. Let them ask some questions. Like, if you are someone who is a survivor of sexual assault, if you are someone who, maybe you want a female provider, whatever the case may be, or you want to know the person's philosophy on care. You know what I mean? Do you want to know, do they work from an informed consent perspective? Sit there and ask them those questions before you allow them to do anything. And if they can't answer the questions for you in a way that makes you feel centered and makes you feel like, okay. And I mean, like, use your intuition as well. Like, we oftentimes don't use our intuition. If something doesn't feel right, then don't do it. And then you can seek out another medical provider for you to be able to provide that care. But the same way they want to interview us and look at a chart is the same way you can interview them. Because remember that it's also a transactional relationship and you are a consumer. And as a consumer who is going into a space where somebody is providing you a service, you have the right. You have the right to ask for that. You have the right to ask as many questions as you want until you get the necessary, until you feel affirmed in the space that you're in. And if you don't, then I would say move from that space.
This field is our home. We fight.
I'm good. Little man.
Okay, and let's see. So I want to be mindful of time. I think we might have time for maybe one or two more questions. And just a reminder to everyone, if there are any questions that we don't get to, we'll be putting them on the community forum in the app. And Chanel has graciously said that she'll be able to answer those questions. So do not worry, all questions will be answered, whether live or on the app. One other question that we had was, how can we empower and or remove barriers for more Black women to practice full spectrum doula care? Any funding streams that you may recommend?
Okay. So first I would remove the word empower, because I think empowerment is based on where someone is at the particular moment. And it's based on the resources that they have available, right? So you can give someone the information that they need so that they can make an informed decision, but it's up to them to choose, what level of empowerment that looks like to them. And that's just my own personal belief. I would say funding, in terms of funding, there's many different organizations that are offering funding. So like Ancient Song, we offer funding. We have the Juneteenth Mercy Fund, to be able to support initiatives of doulas who are starting out a new business or doing work, or wanting to take a training or even going into midwifery school. There's the Birth Sanctuary. They've been giving out recent scholarships to be able to, and funding to be able to do work. Look for alternatives. So like programs that offer like work study, or sometimes like, I know in the past we've given out training for free to community members, when we're able to, like, when we get funding to be able to do so. So yeah, I mean, there's different GoFundMe, you know what I mean? Setting up a GoFundMe, doing a Cash App. But organizations, most of the organizations, full spectrum organizations of color and some others will offer like some form of way for folks to be able to take the training that is not going to um, be at a disadvantage to them. So that, like, again, whether it be barter, and be open, you know what I'm saying? Like, say, listen, I'll barter my time. Like, what does barter look like in me being able to do this, do this work? As well, to look at, to look at it from another form of currency, because people's time is valuable as well. You know what I mean? And being able to do that and honoring their skills is also, to me, I believe, an asset. So yeah, those are some of the things you could do.
Wonderful. And I think we have time for maybe one last question. We have a question that says, do you believe that Black women can offer a luxury doula service as their white counterparts?
Yeah, why not? I mean, listen, okay. I'm not, I definitely believe that you can. And I believe that you can do it from an equitable way, right? I think that, within the capitalist framework that we live in, and it is a very capitalist framework, we have to understand though why we wanted to do this work, um, and just understand that when you're offering the services, you just do it in an equitable way. You know what I mean? Like, and that can mean, and so like, you know, there are people who want to charge from a certain perspective, who want to be able to offer the services so that it's equitable for everyone. But in terms of luxury, why can't we offer that same level of luxury to the person who can't necessarily afford what we would consider to be luxury, right? So I look at it from that perspective, like there's one hand to give and there's one hand to receive. Do the luxury service, right? But for every client that you get that can pay full price, that should offset the cost of somebody who can't pay, right? So that they too can feel like they can get that service just like anybody else. Um, so yeah, I mean, there's nothing wrong with promoting yourself in a particular way. You know what I mean? Whatever feels good to you. I tell people when I, do doula training, it's not about doing your doula work from any one perspective. Do the perspective that feels good to you. You know what I mean? Like, your community, the community you want to serve. Do it with purpose, do it with passion, do it in a way that centers hope and equity and accountability. You know what I mean? To ensure that people feel seen, they feel heard, and they know that you genuinely care, and understand to be fluid in that approach. And I think that if you do that, it won't, matter whether it's a luxury service or not. People will feel like I'm welcome there. You know what I mean? And you can still, be able to sustain yourself and do the work that you love to do in a way that's
And
you.
oh, sorry, I think there's a little bit of
It's
lag.
okay.
My Wi-Fi is a little spotty, but I just wanted to thank you for such an amazing presentation and thank all of our attendees for joining us. I just wanted to bring everyone's attention that we have 2 sessions beginning at 1:40 that are film screenings, one on the stories of Black motherhood and the second on the power in labor. Thank you so much, everyone. And thank you again, Chanel, for such a wonderful presentation.
Thank you. Thank you for having me. And thank you for the little faux pas that happen in here. It's gotta be one day where, faux pas happen, but I appreciate you all. And if you have questions, like, hit me up.
Thank you so much, everyone.
All right, peace.